employment. And there are three reasons that LeadingAge Virginia came out with our statement in support of LeadingAge National Statement and the statement released by the Virginia Hospital and Healthcare Association. And those reasons were, number one, our position reflects the ethical obligation of providers to deliver safe, quality care to older adults and others that they serve. Number two, we know the COVID-19 vaccine is the most effective tool to protect individuals from the virus. And especially with this uptick of what we're seeing with the Delta variant, now more than ever, we need the remaining team members that have not been vaccinated to be vaccinated. And lastly, we know that our staff, really, they are the heart of everything we do. And this is not just about providing a safe employment opportunity, a safe environment for our residents and clients, but also for our team members. They can continue to feel confident when they come into work each and every day that they are working in the safest place possible. So, we've gotten a fair amount of press from it, and we're hoping that all of that supports your efforts. As we know, members are beginning to put timelines to this on when they're going to enforce a vaccine mandate. So with that, if you have any questions about the LeadingAge Virginia statement, feel free to ask me. Our board supported the release of that statement. Dana just said you can put those questions in the chat and we will monitor those and get you some answers. But in the meantime, I am going to turn it over to Corey Kalheim from LeadingAge National to share his insights on making vaccine a condition of employment. Thanks again, Corey, for being here.
All right. Thank you, Melissa. My pleasure to be here today. And to start things off, I just put a link in the chat for everybody. That way they can see it, because I'll be referring to that document quite a few times today. And as Melissa mentioned, we are LeadingAge put out a statement regarding our support for employers in the healthcare settings mandating vaccines as a condition of employment. And we joined with a bunch of other groups in that announcement. I think other long-term care provider groups on the national level have joined in on that as well. And we can kind of see what states are doing, as well as the federal government is doing in this area. Things are moving quite quickly. But to start, I want to go back and kind of talk about where we were and where we are now, just so we have an idea of what we're dealing with the mandates, to make you feel comfortable with kind of the evolving positions and thoughts regarding mandating vaccines throughout this pandemic, or I should say at least within the last calendar year, when we started getting them at the end of December. So first of all, we get a lot of questions about the federal government. Can the federal government actually mandate a vaccine for its citizens? And the answer to that is probably not. Okay, the healthcare regulations are typically the auspice of states, and so we've never seen the actual federal government mandate a vaccine for its citizens. However, that being said, and I don't think this administration has any desire or inkling to actually mandate for the general population the COVID-19 vaccine. Okay, they do, however, have the ability to mandate and the authority over their federal workforce. So if you have seen recently, the Veterans Administration has come out with a proposed vaccine mandate for their frontline healthcare workers within the VA system. In addition, the Biden administration has said the federal workforce, it's not a full mandate, but they are going to be required to be vaccinated or be subject to weekly or biweekly testing moving forward. And so the federal government has authority over its workforce, but it doesn't have that broad general authority to come out with a vaccine mandate for the general public and all citizens. Okay. And then, so if the federal government only has the authority over its workforce, then what about the states? So typically the states this is where the authority to have vaccine mandates in place is at the state level, okay? And this dates back to a court decision, a Supreme Court decision in the early 1900s, and it allowed the state and our local locality to issue a vaccine mandate under the auspice of protecting public health. And I think that authority is well stated, well grounded, and so that's where the states have the authority to actually have a mandate for their citizens. We've seen that in areas throughout history. There's vaccine mandates for children to go to school. Okay, there's other vaccine mandates for travel, other areas, and so they clearly have the ability to do that at the state level. Curiously enough, with the COVID-19 vaccine, and if you recall, about half the states have a mandate for healthcare workers to get the flu vaccine, subject to a couple of exemptions that are available, which we'll talk about later. And so they've addressed the flu vaccine for healthcare workers. What we're seeing now, though, since the vaccines have become a political issue rather than a science issue more so today, we're seeing states all across the board saying, hey, we're exploring whether we have to have prohibiting employers from issuing a mandate in certain areas, encouraging them, allowing them, et cetera. And so we're seeing a lot of movement on the state level. Recently, California has come out and said that they're going to require their public employees to be vaccinated. New York City has done the same. And then New Jersey, I think earlier this week, announced that they are going to have their state-run healthcare facilities be subject to a vaccine mandate. So clearly this is where the action is. It's on the state level. And curiously enough, there's one state, in the state of Oregon, which has a law on the books, which is kind of opposite of what we've seen, is that they have a law saying that employers cannot mandate vaccines for healthcare employees, which I think is fascinating that they have that, and they're the only state that has that. And so now at this point, they're trying to figure out how to get that reversed. So they're doing the actual advocacy to have them readdress that based in light of this current pandemic situation. Okay, and so we've talked about the federal government's ability or lack of ability, subject to just their workforce. The states have a lot more flexibility and ability to do so, and we're seeing that all across the board on what states may or may not be looking at. We've been seeing this right from the beginning of the year as well. We saw a lot of bills introduced in state legislatures in January saying, hey, we are going to prohibit employers from mandating vaccines. Now, those bills didn't go anywhere. They haven't passed. And I think everybody's kind of watching as the vaccines played out. And then here we are with not as much uptake of the vaccine as we had anticipated and hoped for. And so we'll see if there's any renewed efforts, especially in light of where we are with the Delta variant, where states' thought process may be thinking. But there's a lot of play regarding schools and other workforces within the state control. That leaves private employers, and where and what can private employers do? Okay, and then this is complicated by the issue of the vaccines currently being under the emergency use authorization. Okay, the EEOC came out with guidance at the end of last year. And they basically, in December, they basically said, if private employers are going to mandate the vaccine, here's what they need to follow. So they didn't exactly address whether you could or couldn't, but they made a pretty strong statement and insinuation that you're able to do so. And that has been, I think, reinforced by a couple court decisions and a recent Department of Justice memo. Okay, so the court decision, there was the hospital, the Methodist Hospital in Houston, who issued a vaccine mandate for their employees. They were challenged by a small group of their employees, and they actually, it was upheld in court and said, under Texas law, you have the absolute authority to issue a mandate as a private employer on your workforce. Interestingly enough, just talking about numbers, because this goes back to the workforce question, they had about 180 people who did not want to get vaccinated and were challenging the vaccine mandate. They have about 26,000 employees. So it was a very, very small percentage of folks who actually were challenging the mandate. And so I think that is something to keep in mind. And this is Texas too. And so something to keep in mind when you're dealing with the workforce shortage and crisis as we're dealing with these issues, and when and how and if you are looking to do a vaccine mandate. And so that was the case in Texas. So I think that was a pretty strong support for saying, hey, you can mandate as a private employer. Yeah, the University of Indiana, as well as many other private or public institutions and private institutions and colleges, are instituting vaccine mandates for their students and staff as they are returning to campus in the fall. And so the Indiana University was challenged, and that was upheld initially by a district court, federal district court judge, and in addition, it was just upheld by the Court of Appeals, saying that Indiana University has the right to issue a vaccine mandate for its students and staff upon returning. So I think you couple with that, I think there's strong support saying private employers have the absolute right to do that. And also, the question then became under the EUA authority, there's a little hesitation on whether we had the ability to mandate under the EUA, the emergency use authorization for the Pfizer, Moderna, and the Johnson & Johnson. The Department of Justice a couple weeks ago actually delivered and issued a memo saying that there is no prohibition against issuing a mandate under the FDA emergency use authorization process. And so they basically cleared the way and said that EUA is not a factor that you need to that will prohibit initiating a vaccine mandate. And so I think with those three and the court decisions that we've seen, I think employers, especially private employers in the state level, are on very, very solid ground on legally being able to issue a vaccine mandate. Okay. And so then the question then becomes is how do you do it? Would you want to do it? And this operationally, how to do it as well. And I think that as we've seen, I think that one of the things that is the question is still with the EUA is when do we expect full approval? Because whether or not you can legally do it with the EUA authorization, I think that's pretty settled. There's still kind of the psychological effect that some people have stated in their hesitancy on getting the vaccine is that they're not full FDA approved at this point. And so the question has been is when do we expect full FDA approval? And recently, I think there's an article in either the Washington Post or the New York Times that the FDA has made it a high priority to try to get full FDA approval, hopefully by Labor Day or the end of August here. So I think we've seen that process has sped up a little bit because they technically have until January to issue or deny the full approval for the two vaccines, the Pfizer and the Moderna, who are in fully. And so I think that we'll see a decision well before that at this point. And so that is very, very helpful, especially for those that were concerned about that. And also time-wise now, since we are at the beginning of August, if you were to implement one, I think you can take that into consideration when that may be issued. And then in the meantime, as we're seeing all of these state governments do things, we're also seeing some private employers jump in. I think a couple of the notable ones this week, that one relevant to our field and another one relevant to just generally large employers, is the large employers, Tyson Foods, the food manufacturing business, they are mandating it for their frontline workers soon. And so they are going to have that in place, which affects a lot of other workforces. We've seen Walmart, which is instituting it for their corporate offices. They have not instituted it for their front line as of yet, but they're instituting it for their, I think, 17,000 employees at their corporate office in Arkansas. And then finally, I think we saw in the news, I think yesterday, Genesis, one of the largest, if not the largest, nursing home providers in the United States, is mandating the vaccine. And they're actually on a pretty quick timeline. I think they have about a 3-week or a month lead in until their staff needs to be vaccinated or at least receive their first shot. And so we're seeing more and more of these efforts. And as Melissa mentioned, I think some of the hospital systems are clearly coming out in favor and instituting vaccines as a condition of employment as well. We've seen a concerted effort in Maryland where the Hospital Association and the big hospital systems have come out and said that they're going to initiate these. I think we've seen the Mayo Clinic and some other large organizations throughout the country kind of start moving in that direction. And so I think the momentum is clearly there in that sense. So if there's before we get into kind of the nuts and bolts and stuff to think about, if you're thinking of instituting a mandate, I think this would be a good time to have any questions or clarifications on just kind of the logistics of where we started and how things have kind of morphed to where we are right now. If there's any questions, this would be a good time for those, and then you can put them in the chat as well.
Corey, thank you so much for those remarks. I have some questions that a member was interested in knowing if a community could be held liable for illness of a death of a resident if the facility decides to not make their vaccine mandatory.
That's a good question, Dana. So the question is, if we mandate, then we have taken that extra step, versus if we don't mandate, are we then going to be under more scrutiny or potentially subject to more liability because we did not mandate? I think the question is, it depends, and it depends on a couple of things. Okay, right now, up until the point of vaccines, when we had a lot of infections, and we did have some deaths and injuries in nursing facilities. I think the key to look at when you're looking at the liability issue for injuries to residents was you're looking at following the guidance and the protocols that were in place. And so that guidance included CDC guidance. It included whatever State Department of Health guidance there was. And then, maybe some CMS guidance, which hopefully jived with the CDC and the state guidance. And so you're looking at all those different guidances that were coming out. Okay. And so your best defense was documenting what you were doing as far as infection protocols, leave, all of these different entities, distancing, masking, PPE, all the different variables that were in play. Your best defense was documenting what you were doing in real time versus what the guidance was, okay? Because the standard of care is a reasonable standard of care dealing with what the standard is at the time, okay? And so I think when we get into the vaccines then, we've got the vaccines that came around in the beginning of, or the end of December. And so as we were getting vaccinated, as folks were getting vaccinated, I think the standard of care as far as PPE and all of that wasn't really changing until we saw the numbers going down. Okay. And so as the numbers were going down, things were loosening up. And so you were following the protocol that was in place at the time. I think what's important is if you're, whether you mandate the vaccine or don't mandate the vaccine, I think the key is to continue to follow whatever the applicable guidance is that's out there and document why you're doing that. Okay. You have a very legitimate reason whether you are going to mandate or not mandate. And those are whether that's a business decision not to mandate because of workforce shortages or other concerns. I think you just need to make sure that you have it documented and you can explain what was happening and you're following all these other protocols. I think the other thing that comes into play when we're dealing with this is we all know that the vaccines are the best defense that we have right now on preventing COVID and especially preventing serious side effects from COVID. However, we also know that there are some breakthrough cases. Even if the resident is vaccinated, they can still potentially get COVID. And even if a staff member is vaccinated, they still can potentially get COVID, okay? And so I think that as the science evolves, I think we'll know a little bit more as well. And so I think just following what is the guidance at the time, I think is very, very helpful. Now, do I think that if you have a staff that is at 20% versus a staff that's at 80%, I think your risk is different in those scenarios. Okay, and I think then as long as the questions that's going to come up is why were you at 20% versus 80% when you had the ability to maybe mandate a vaccine? I think that's important, but I'm not sure that's necessarily going to be the ultimate question on the liability issue, because if you're following all the other infection protocols and everything that's in place, I think that's more important than the actual mandate itself at certain points. And so it's tough to tell too, is as the science progresses, I think we'll know more as far as breakthrough infections, transmissibility, and all of those things. But I think it's kind of a real-time exercise when you're dealing with liability issues. And in addition, I think it's super important when you talk about what the guidance is to maintain all the protections on the PPE, the screening, the removal from work, all of those different provisions. I think that's just as important as whether there's an actual vaccine mandate, because I think at the end of the day, too, it's really, really difficult sometimes, as we've seen, to figure out where and how some of these cases are coming in and getting in at this point. At the beginning, I think it was pretty clear on how these are being transmitted. I think now it's a little trickier when you've got some people vaccinated, others not, the screening process in place and the like. And so I think this is going to be interesting to see how this plays out. I think certainly it's not a be all end all on the liability question, but I think it's kind of in flux. And maybe I think that'll be kind of morphing as we go along too. I think one other thing you might want to talk about too is work with your insurance providers and carriers and to get their thoughts on it, as to what they may be dealing with or looking at when you're dealing with the general liability, especially on your the resident side. So sorry, that's a long-winded answer. I think it depends.
Yeah, thank you, Corey. That was really helpful. Thank you for that. Another question. If you are a community that is mandating or moving toward a mandate, what documentation does that community need to have in place for employees claiming religious or medical exemptions?
Okay, this is a great question. I think this is, so for those folks that are looking at this, since Virginia doesn't have a flu vaccine mandate, I don't think there's going to be quite as many providers, and I could be wrong. And if you have a flu vaccine requirement in place right now, I think the process is going to be very, very similar to that. And here is the process that we're kind of talking about, and it's outlined in the link in the EEOC document that I sent along. Okay, so if you're going to have a vaccine mandate as a condition of employment, I think there's a couple things you need to think about. Okay, right now, I think number one, you need to think about timing. Okay, so it is August 4th. You've done a lot of education. You've gone through different programs to get your staff vaccinated. So I think number one is you need to figure out where you're at. So if you're at 40% of your staff and you're at 80% of your, or at 80%, you're going to have a little different considerations and potential timeline issues that you want to think about. Okay, you may want to speed it up if you're really close. You may want to give a longer period of time to get vaccinated if you're not as close, okay, for operational reasons and other considerations. I think number two then is you want to continue the education opportunities that you're doing and even maybe institute some other different perspectives and try something that you haven't really looked at before. But also I think that as the EUA and full FDA approval process, if we're anticipating it at the end of this month, I think that you may want to take that into consideration when you set the date as to when folks need to have at least their first shot. Okay, and I think what you do is you have to have a timeline where they get their first shot. And in case of the Johnson & Johnson, that's their only shot. But then let's say you require their first shot by September 15th, and then you need to actually require their second shot by October 15th or whatever the timeline, whether it's a 3 or 4 week, and then maybe add in a couple weeks just because of logistical issues and all of that. And so then you've got the drop in date where you're coming up with those. Okay, so let's say then that's the November 1st or whatever we end up with. Okay, then I think what you need to do is you need to work back from there to really have a timeline then as to the first shot, where let's say it's September 15th. That's when folks need to actually have their request for the accommodation, whether it's a medical or disability related accommodation or it's a religious accommodation. Okay, and then there's a little bit of difference when you look at these within the EEOC guidance, and so I think it's important to take a look at that. But what you basically need is you need a request similar to, and I suggest just a simple form. The form probably works best. They can make it verbally, as we've seen with other accommodation requests. And so I think that you need just kind of a form in place and to identify what that is. And then I think you need a process to either gather more information if it's a medical request, have the process to see that it's actually a confirmed medical request. And they may be proactive and get something from their doctor and submit that to you. And so you've got that. But I think you just need to know the information of what that potential accommodation or request is. And the same thing on the religious side, because they need to have a sincerely held religious belief. Okay, and so once you get those, then I think you set a timeline of we will review these by X date. And so maybe, maybe actually push the timeline up to September 1st so you can review them within 2 weeks. And if your decision is no, on the accommodation, then you give them time to actually get vaccinated within the timeline, or you adjust it a little bit for them. But I think it's important then too, it is to have the process in place on who is going to actually review the requests, okay? And it's going to be a multidisciplinary team. I think for the medical requests, it probably makes sense to have a physician who is versed in these types of accommodations and requests. And I think it's also very important to have an HR person. Okay. And you may have some other folks involved as well, but I think those are probably the two key areas that you at least want to have some representation from. And then they'll make the ultimate decision on those. And then you'll kick it back to the individual one way or another on that decision and kind of work through that interactive process. And at the end of the day, following the EEOC guidance, if they refuse, they don't have a legitimate one, then they either need to get vaccinated or not. And if they do have a legitimate accommodation request, then you need to go through that process and figure out how you're going to make that work within that workforce, okay? And so if they're a frontline worker, they may not have the ability to move into another position. Some may, but some may not, okay? And in addition, so if they're not getting vaccinated and they're still, quote unquote, a direct threat, then you're able to terminate their employment under the EEOC guidance. And so I think that's the process, I think, is important. The actual documentation itself, making that request, I think having just a simple form that says, and I'll look for a form that I can send out if I can find one. But I don't think it has to be anything more simple than what is your request, and then we'll go through that process. And so it's a slightly different on the religious one versus the medical one because of HIPAA concerns, ADA concerns, as well as it needs to be a sincerely held religious belief. And I don't think that there's a lot of religions that have a sincerely held belief in place regarding vaccines. So I think that's important to kind of just make sure that you have that process in place.
Thank you. Some comments are coming into the chat room, kind of asking other members of how they're handling certain situations, and I can read those. But 2 questions that have come in, Corey. We have multiple reports of vaccinated people getting COVID with symptoms. How do you address this with staff that do not want to get the vaccine? And a second question, if employees decide not to quit before the mandate deadline, what could be expected from the Virginia Employment Commission?
Okay, I'm going to answer the first one, and then hopefully I will try to remember the second one, but you may have to refresh my memory after I get done with the first one.
Sure, sorry I gave this at the same time.
That's all right. And actually, one of the comments was perfect. I forgot that some of the very best resources are from the Society of Human Resources Management, the SHRM. They do have some good forms available, and they do have very good articles on how to address some of these accommodation requests, because it's not dissimilar to some of your other employment accommodation requests. And so I think just be mindful for that. As far as making the argument with your staff about the breakthrough infections that we're seeing, okay? I think one thing to really, first of all, you've got to be honest with them that we are seeing some breakthrough infections. There's no doubt that we're seeing them. The numbers are incredibly low. So I would look for some of the most current CDC data on breakthrough infections. And I know that they are, in the last I heard or saw, we're in the 1% range as far as breakthrough infections. And I think that in addition to that, it's really important to stress that if you're seeing those breakthrough infections and they may have symptoms, they're not nearly as severe as folks who are getting COVID prior, and the prior version of COVID, and especially the ones that with the Delta variant. We're seeing a little more severity, I think, with the Delta variant. And And so they're still getting them, but they're not, the folks that are vaccinated are not getting as severely sick, and they're certainly not getting hospitalized at nearly the same numbers as we were seeing before. And so I think the question then is, do you really want to get COVID or and have awful symptoms, or do you want to have it with a very mild case? I think that is the other thing. And I think the more cases that we see of the mild COVID, especially during the Delta variant and even the prior versions, is the long-term complications, I think, are much more severe for the folks that have it that weren't vaccinated versus the ones that were vaccinated. Now, we don't have all of that data yet, and I think it'll take some time. But nonetheless, I think that's what we're seeing, and that's what all the medical experts are saying is, look, the severity of those breakthrough infections are not anything close to what the Delta variant is bringing at this point. And on the second question, can you just say it really quickly again, because I want to make sure that I get it clear. Oops, I think you're still muted, Dana.
All right, I'm getting it together now. If employees decide not to quit before the mandate deadline, what could we expect from the Virginia Employment Commission?
That is a good question. I don't know. I don't know the answer to that. I think what we've seen from, and it's gonna vary, I think, by state. But as far as the attitude from the employment commissions, we're all trying to get folks vaccinated, and I think that the employment commissions realize, especially kind of what I laid out before, is that the states have the opportunity to mandate vaccines, and the private employers have the opportunity to do that. And so I think that they have to deal with the reality of the situation that we're in. And I think the other thing is, especially with the type of business that we're in, okay, it's one thing if you're mandating a vaccine for a remote workforce. It's quite another when you're thinking of a vaccine mandate for those that are doing frontline healthcare work. And that's where we are. And so I think you've got that legitimate business reason to do that. And so I think that they're going to view these scenarios different than other scenarios when people may be in less of a personal care or less necessary to have folks vaccinated. But at the same time, I don't know how not knowing the Virginia department there, I don't know how they would react, to be honest. And maybe some others have some better insight on that.
Yeah, we can definitely look into that from the Virginia perspective and get some information for the members. Corey, another question is, any concern with the community requiring unvaccinated staff to wear N95 masks and vaccinated staff in K95 or surgical masks? The response here is, I'm thinking that now when we haven't yet mandated the vaccine, and the same question if we were to mandate the vaccine.
Okay, this is an interesting question. So I think that one of the things that we were dealing with unvaccinated staff versus vaccinated staff, I think with the unvaccinated staff, the N95s were kind of the gold standard in what you should do. Now, I don't know exactly what the state is saying on this, but at the same time, then I think we need to consider what OSHA is saying on this. And what OSHA is saying on this is, under their emergency temporary standard, is if you're in a situation where somebody needs to be wearing a mask or a respirator, they need to be wearing an N95 mask, not a KN95 or surgical mask. And so I think I think I would follow the OSHA guidance in the sense that if they need a respirator, they should be wearing the N95 and not a substitute, just to make sure that you're in compliance with OSHA. That's one of the things that we had seen, kind of backing up with the flu vaccine. Okay. So when you had a flu vaccine in place and people decided not to get the flu vaccine for whatever reason, whether it was mandatory or not, what we would see was that the folks that did not get the flu vaccine prior, they were wearing PPE and masking while the unvaccinated or the vaccinated staff were not. Okay. And so I think that that's analogous to what we're seeing at some points with COVID here, is that the unvaccinated staff still need to mask at all times. And then the vaccinated staff have some ability to not mask as much in certain scenarios, especially with all other vaccinated residents and or vaccinated staff. You've got a little more leeway. So I would be just mindful of that. And especially when you're with OSHA, if you're going to need to wear a mask, it should be an N95 mask as far as respiratory protection in that sense.
Thank you. And I want to thank the members that are putting comments in the chat box to some of the questions about how communities are handling certain issues. So I think this would be a good time to see if there's members on the call that would like to talk about their policies where they're moving toward a mandate, or if there are any questions regarding that.
Dana, this is John Burns. I'll share what we're doing at Westminster Canterbury if you want.
Yeah, great. Thank you, John.
All right. Hello, everyone. Westminster Canterbury Richmond is implementing a vaccine mandate effective September 1st. There's a number of us who are in that timeline of starting a mandate about September 1st. I believe Westminster Canterbury Charlottesville's in process. I believe Goodwin House might be a little bit ahead of us. There's a few other communities here in Richmond who are a few steps behind us. But our experience as a community, we decided to mandate the vaccine in June is when we made the decision. Then we did what Corey described. We looked at our vaccination rates, and we backed into how long is it going to take us to get to where we want to be, knowing everybody's got to get 2 shots plus 2 weeks. Realistically, we said it's going to take us at least 60 days, probably closer to 75 if we can hit the ground running. September 1 was aggressive. At the time, going back to the June timeline, I don't have the numbers for then, but we have about 270 individuals that work regularly in our healthcare center between RNs, CNAs, LPNs, physicians, rehab staff, private sitters, the whole gamut of everyone. It's 270 some odd. I think at the time, back when we made the decision, we were somewhere between 65 and 70% for that group. Now, we're a big community. We have 400 or so staff who don't work in healthcare. The rates were much higher, frankly, in a lot of the administrative departments, many departments at 100%. But our overall number was about 72% back when we made the decision. We made it clear you could exempt either for health, documented health reasons. You needed a physician to support that. Religious accommodation, you just needed to basically tell us what that was and put it in documentation, or you needed to check that you understood on August 30th. August 31st, you were going to be resigning voluntarily from Westminster Canterbury. We've got policies, to someone's question, we mirrored and made it part of the same policy as our influenza vaccine mandate policy. So those are very, very similar. The practical application of the policy is the same. To date, we have, of the 271, we have 223 are fully vaccinated. That leaves about 38 people who are not yet vaccinated. Half of them are in process. We've had 2 people resign. We've had 2 people out of that 271. We've had 3 people resign, and we've had 6 provide us or in process of providing us with exemption. And so we're now working with a handful. 17 or 18 individuals to get them to get this process, to tell us where they are in the process, whether they're going to pursue vaccination or they're going to step out. No one's fought it. No one's argued with us about it. A couple people just gave us their resignation. There are a small number who are struggling with the decision, and will make a decision in the next couple of weeks. Our residents are very supportive of this decision. Our board is 100% in support of the decision. Management's very supportive of the decision. We understand we might lose a few people, but we do not want to have a resident get sick. And we had, backing up now, but back in June, we had an unvaccinated RN test positive, and it put us back in lockdown, no visitation, full PPE for 3 weeks. And it was not a pleasant experience for anyone. The residents were angry. Their families were very angry. The staff were very angry because they were in full PPE in the middle of summer, and they were not happy about it. And so there's a lot of peer pressure on staff to get vaccinated and stop doing this. We calculated that event with all the PPE and all the testing cost us over $100,000 for one staff member testing positive. One interesting thing, I don't know if communities have experienced this, but because PPE is no longer a hard thing to get, Virginia Department of Health took a very aggressive line on how we had to use PPE, and we burned through unprecedented amounts of gowns and masks. And I mean, it was very difficult to manage, different than back when we had positive cases and everybody was managing it differently. So that's kind of our story. We're happy to share our policies and our forms if anybody's interested. I won't take credit for them. We borrowed them and stole them from others, and a bunch of communities that were working on this worked together to create some forms that have worked and worked for us. Really important to know exactly who's where in the process in terms of vaccinated, unvaccinated, in process, pursuing exemption. That's really helpful to know who we need to educate or sit down with individually and figure out what they're going to do. Because August 31st, we can't have 15 staff members not show up. That's the worst case scenario. So we need to know well in advance what their plans are. So I'll stop there, and if anybody has any questions, you can ask them.
Well, John, thank you. Yes, we are getting some requests for those policies. So I think if you share those with us, we could put those on our COVID website. So we will get that information out to everybody. John, for those employees that claimed claimed an exemption, after review of that, how did you handle those that you determined to be justified?
If someone provides us with the documentation, they sign the form that says they're going to provide us with the documentation. They provide us with that documentation, then they're going to need to wear an N95, and we'll provide them with a new N95 every day. And that's true across the whole company, obviously, not just in healthcare. But those numbers are pretty small. I think it's going to be somewhere between 10 and 12 probably at the end of the day. So that's at this point, that's what, and it's indefinite. We haven't put a timeline on how long they're going to have to wear a mask, similar to what we would do with the flu. It's exactly the same as what we require of staff who receive an accommodation for the influenza vaccine.
Thank you. That was really helpful insight to your policies and how you're getting those implemented. Are there other members that would like to talk about their policies that they're moving forward with?
Hey, Dana, it's Mo.
Hi, Mo. Thank you. I was getting ready to call. I was going to call you out.
First of all, John, I'm glad to hear and see that you kind of led the charge on this vaccine mandate. On Monday, August 2nd, Beth Shalom in Richmond went with a vaccine mandate policy, not only for the vaccine, for COVID vaccine, but also any subsequent required booster vaccines are part of our policy. In addition, we added the influenza vaccine as a requirement, so that that's a all-encompassing policy, so that we're not having to deal with this in flu season, and we're dealing with the quote-unquote never vaxxers now. We have a September 15th deadline. By August 15th, those who have not been vaccinated have to demonstrate that they've had at least one course of their multi-injection done, and or have commenced the process that we have put in place in our policy for either the religious and or the medical exemption. Both of those exemptions will be decided by September 1st. And anybody who does not take the vaccine or exemption that has not been satisfactorily approved by us will have been considered to be voluntarily resigned from their position, full stop. That's it. We're not, the medical exemption is pretty specific by vaccine, exactly what is within each of those vaccines that is the issue that's causing the problem. We are requiring that an MD or a DO sign that form, and one form for each of those two vaccines, the COVID vaccine and the influenza vaccine. In addition, we have the religious exemption, and all of these things certainly are ADA, appropriate. But the religious exemption, we are requiring a second individual to attest to the fact that they are aware that that individual is, I forgot the term off the top of my head, but has been practicing that religion, that and they're aware that they are trying to opt out related to their religious beliefs from either one or both of those vaccines. So I don't have numbers to share with you like John yet, but I will tell you overall, we had about 68 or 69 total unvaccinated staff on campus. And we are seeing, at least in the last couple of days, and we're only a couple of days in now, we've had a handful of people already go get their first injection, and indicate that they are willing to comply with the policy. So we'll see how it goes, and we'll know better on August 15th where we really stand and how it's going to go down for us. But again, we also, like John, have full support of our board, full support of our staff, and full support of our family members and residents. So we're looking forward to this kind of moving along and getting to a place where we, have a fully vaccinated staff environment. One additional thing I'll share with you is, like John, today we have a confirmed PCR test of a staff member who was vaccinated who has COVID-19 in our skilled nursing facility. So we started again, just like John, with the fire drill of PPE and N95 masks and all that stuff. Yeah, this has not been fun, but we have some good policies, we think, in place, at least at this point.
Thanks, Mo. Thank you so much. Is there anyone else that would like to share their policies?
Hi, Dana. It's Rebecca from Beth Shalom Village in Virginia Beach. Hope everybody is doing well. Great information on this call. I did want to share that Beth Shalom in Virginia Beach did go live, and we are completely, anybody being hired has to be fully vaccinated, and all of our staff had to be fully vaccinated by July 1st. And I'm very happy to say out of over 260 employees campus-wide, that's our assisted living and our skilled nursing facility and long-term care facility, we only have 4 people that are not vaccinated.
Wow.
So very positive feedback from staff. They understand. Leadership had to take a stance to do the right thing. And as Mo indicated at his community and others on this call, we had great support by our board and our family members. And although we are fully vaccinated, we are seeing breakthrough cases in the community, not resident or patient wise, but, staff, and we're still very vigilant with the screening process for everyone and just really following up and making sure that we stay on top of those that are being hired and that they are fully vaccinated.
Thanks, Rebecca.
You're
Hey,
welcome.
Dana,
Yes, I'm sorry.
this John Burns. I just wanted to add something that relates to what she was just saying. I think all the communities are probably starting to see breakthrough cases in staff who, are fully vaccinated, but they're testing positive, and we've had a small number of them, and anecdotally, the evidence suggests they're getting it on vacation and they're bringing it back, and often from visiting with little kids. And so we, I think, effective in about an hour, it's going through the bureaucratic engine right now. We'll be re-implementing a policy to test staff who travel away from home by any means, even for the day. We're going to do a rapid test on them their first day back, because we're just seeing an awful lot of people who go away even for just a day to see family or coming back and then testing positive. So we're starting. Somebody asked earlier, what are communities doing? That's something we've reinstituted. We've also gone back to a staff, contractor, and visitor mask mandate, but we're definitely going to start doing rapid tests on everybody who's visiting with anyone away from their own home.
John, how are you all handling contractors and agency type home care, or anybody on the call today that would like to respond to that?
They have to be vaccinated. We treat them just like staff, and so and by and large, they've been compliant. We only have a couple of private sitters, who we're chasing down. We're lucky Genesis is our PTOT provider, and they're moving in that direction. And so they've been compliant. Our pharmacies getting there. But so, yeah, I mean, our physicians they've been very, very helpful. So we treat everybody who works in healthcare exactly the same, and they have to comply with all the same rules to work here.
Dana, this is Mo. We gave all of our contractors, whether they're healthcare providers or service personnel, the same time frame to be compliant, and that we will be asking for vaccination cards for anybody who enters any of our buildings from any of those service personnel in order to be on campus.
And
Thank
Dana,
Yeah.
sorry, just to chime in, that's what we're seeing with other providers as well, because just for consistency, and like folks have said, it just makes more sense. If they're coming and going, you want to have the same and consistent policy. And then kind of to piggyback on what John, Mo, and Rebecca said too, as far as numbers, and this is anecdotally, and I'm glad that we've got some hard numbers from folks, is the percentage of the workforce that has either resigned or quit or has been not through the accommodation process has been very small. So anecdotally, what we've heard from members, it's been between about 1% to 3%. And so would love to continue to gather that data, just so we have that to show to other providers, because that is the main driver right now of why folks are hesitant to issue a vaccine mandate, is the potential for losing staff. And so with the lower numbers, and if we can get more of that consistency and more data, I think that will help others realize that, when they've instituted them, they haven't had the mass exodus that we've sometimes anticipated. And I know that's going to depend on region and area specifically, but nonetheless, that's what we've heard anecdotally.
Yeah, Corey, this is John Burns at Westminster Canterbury. It's been of the 271 that work in our healthcare staff and contractors, it's essentially right at 1% of the staff have resigned. It's 3 people. So it's a really small number, and it may go up, but it's not going to go up a lot.
So John and Mo, do you differentiate at all between frontline and back staff when it comes to the mandate? I know that Rebecca has responded for that Beth Shalom is not.
We treat all staff. There's a policy for everybody, staff and contractors. Everybody, it's exactly the same.
Anybody that works on our campus.
Okay, great. And what about visitors and independent living residents and their family members? Are you all requiring proof of vaccination?
Westminster Canterbury is not.
Neither is Beth Shalom Richmond at this point. As much as I would like to, no.
So I'm sorry. Right now, we have a sign up at our screening door during the process that we ask visitors to bring proof of vaccination. That way, when they are visiting with their loved ones, if both people are vaccinated, it kind of helps us understand whether or not they can unmask. However, we cannot, the guidelines are very clear. We can't keep anybody from visiting their family if they aren't vaccinated. So there's a fine line that you have to follow with that request.
We were doing the same thing, but just over the last 2 weeks, because unvaccinated and vaccinated people should both be masked.
Correct.
We are making it mandatory that people wear masks no matter what.
Yeah, we're doing masks and shields for the visitors right now.
We do have a response from Charmaine with Brandon Millwoods that they are requiring proof of vaccinations from visitors in independent living. We have about 3 minutes left, so I'd like to just open it up for anyone that would like to ask any questions or comments. Corey, based on what you've heard from some of our members regarding their policy mandates, is there anything that really stuck out at you that you would like to highlight for those members that are thinking about doing it?
I think, hearing from John, Mo, and Rebecca, I think just reinforces that it's not as daunting as it seems. And so the folks that have instituted it was a big hurdle to come to that decision. But once you make that decision, the actual implementation process and moving folks along and explaining it to folks has generally been very smooth. And I think that we forget that the employees have been in this all along with us, and so they are very cognizant of where we are. They understand the justifications for doing it. They may not all agree with it, but I think there's less pushback than we had anticipated. And so I think that once you set and get those policies in place, and I like the idea of really tying it to a flu vaccine moving forward, and so that way you've got the process now. And so when we deal with we're going to have tougher strains of flu in the next few years at some point, and we may have another, knock on wood that we won't have it very soon, but we will have another pandemic at some point, that we've got these kind of policies and procedures in place to how to deal with it. It might as well do it now and address it the best you can. I think that is what we're seeing folks really kind of gravitate towards. And then I think, the trickier part is dealing with those accommodation requests and seeing, I think it's going to come on an individual basis in your community. If you've got 30 people requesting a religious accommodation request, and they're all, on a newfound religion that you haven't really seen before, then I think the question is, how aggressive do you want to be addressing that? Or if it's a small number, is that really where you want to have that big pushback and put the stake in the ground? And so I think just practically, it may vary from different providers, but I think having that process in place is beneficial, and it's been successful from what we've seen.
Well, thank you, Corey. There's been a lot of great information shared. John, did you want to say something? Well, Melissa, have I missed anything? Is there anything?
No.
Okay.
I think we're great. This was an outstanding call. I think we're going to need a follow-up, Dana.
Yeah. Okay. Well, I will say that we will get these policies that were mentioned uploaded on our website. And we'll have some information in our newsletter. Feel free to reach out to us as well if you have any follow-up questions, but we'll be getting all that out to everyone. And thank you again so much for being on the call today. And thank you, Corey and John and Mo and Rebecca. Hope everyone has a great afternoon.
Thank you.